What is the kind of discharge you have, whether it is normal or abnormal. Whenever you have some symptoms like itching or there is some foul smelling discharge, and once in 6 months try to change all the inner garments. Hello, today I am going to talk to you about vaginal discharge. Discharge from the vagina is something every woman experiences. This discharge can either be from the mouth of the uterus, which is called as the cervix, or it can be from the vagina. Well, there is something called as normal physiological discharge, which is very much normal and every woman experiences this. And sometimes this discharge can become abnormal. So what do you call as a normal discharge? Normal discharge is usually white or transparent in color, and it can be seen at any time of the menstrual cycle. Usually increases after the mid-cycle, and usually it is not associated with any itching, and there is no smell associated with the discharge, and it usually just stains the panties and it is not heavy. Now, when you think your discharge is abnormal, whenever you have some symptoms like itching, or there is some foul smelling discharge, or there is excess of discharge, all this means the discharge is abnormal. And sometimes there can also be vaginal irritation and burning sensation while passing urine. So if there are any of these alarming symptoms, then that is the time for you to meet your doctor. So what happens? Why does this happen? Abnormal discharge. There can be some infection in the vagina. Usually the vagina is protected by good bacteria, which is called as the lactobacillus. So whenever there is the good bacteria gets washed away and the bad bacteria or the fungi grows, all these symptoms are experienced. So the gynecologist will check you for what is the kind of discharge you have, whether it is normal or abnormal, and also tests will be taken to see what is the organism or infection that you have, and the treatment will be given accordingly. Certain tips on perineal hygiene. Perineum is an area, where the external part of the genitalia is present. It is an area which is prone to infection. So we have to make sure it is always kept healthy. Never shave the hair of the external genitalia. Trimming is advised. Never use any chemicals like to remove the hair or some lotion or powders. Usually it is not advised to use in the perineal region. If you're going for any washes, go for medicated washes and always ask your gynecologist advice before using them. And make sure that the inner garments that you used are quite clean and healthy and they are well sun-dried before usage. And once in 6 months, try to change all the inner garments. Never wear tight undergarments or tight pants for a long time. That will again cause a lot of sweating in the area, and when sweat accumulates, again there is more chances of infection. And whenever this abnormality is there, always do consult the doctor, because sometimes the cervix can be